My name is Jeffrey Malatack. I'm a professor of pediatrics with an academic affiliation at Thomas Jefferson University and primary clinical responsibility at AI duPont Hospital for Children. I graduated from college with a degree in physics. I thought at that point in my life that I was going to be an astrophysicist. I had a senior project where I was taking observations through the night, and I just realized that I was walking home and everybody was walking to work, and I didn't think I wanted to do that for the rest of my life. Most doctors, if you talk to them, will tell you that someone becomes a model for them. With me, it was a pediatric oncologist. As you go through medical school, you have that moment where you say, I want to do what that person does. I came out of my residency training thinking that I was on my way to Sloan Kettering to be a pediatric oncologist. I had been accepted in that program, and at that point in time, the medical director of the children's hospital that I was working at asked if I'd be interested in supporting a surgeon that turned out to be a world expert in liver transplantation. I ended up going down that road and gaining skill as a transplant immunologist. But I never walked away from being a general pediatrician. Today, I oversee residents in their continuity clinic while I see patients directly in a referral clinic from pediatric practitioners for sort of peculiar medical problems. Every job is hard, and every job has an associated burnout. There is no better job on earth than this job. You got to remember that every day, though. It's a job in which you can't live on last year's information. There is that responsibility you have to stay current, and that requires reading and staying on top of changes in medicine and in the literature. But those are all wonderful parts of a job that keeps it from ever becoming stale. That's what a practitioner and a young student has to remember is you won't find a better job. You just got to stay with it. One always has to deal with parents who worry too much and require reassurance, and parents who worry too little and require you stimulate their sense of vigilance about the care that they need to provide. It is something you have to assess, not only in the child's care, but in the parent who's caring for the child. My primary means of keeping in reasonable condition is swim. I try to swim a few miles a week. In the wintertime, cross-country skiing, and have a little place up in the Pennsylvania Pocono Mountains where I spend time doing a lot of cross-country skiing. Medical information is a right, like education, like medical care is. So it's important that an institution like Merck has committed themselves to making sure that up-to-date information is available to anyone.